We'll get underway formally now, so I'd welcome everyone to today's webinar in this 2019 election series. Before we begin, I wish to acknowledge the traditional owners of the land upon which all participants of this webinar stand and pay my respects to elders past, present and emerging. Today we will hear from Leanne Wells, Chief Executive Officer of the Consumers Health Forum of Australia. Leanne is a health advocate and service executive with over 30 years' experience in health and social policy. She has held executive positions within the federal government and in a range of NGOs nationally and state-based as well. Among her many roles, Leanne is a director of Coordinair Southeast New South Wales Primary Health Network, the AusHelp Foundation, Pain Australia and the Australian Pharmacy Council. She brings a wealth of experience from a number of sectors, which she will share with us today. It's our great pleasure to welcome Leanne to speak with us today.
Thank you, Paul. I'll just go to the first slide. And thanks very much for the opportunity. Child and family health and children's development and health and wellbeing has been a long-standing personal and professional passion of mine. So I can talk about this topic with great pleasure and for a long time. So I'll try and keep it focused to the sorts of things where we have an intersection, I hope, between the sorts of things that the Consumer Health Forum is asking of both parties or all parties in the context of the election. And I think you'll see as I go through where we do have quite a strong intersection and common agenda, I suppose, between ourselves and ARACI. So just a little bit about the Consumers Health Forum. We operate as a forum. We're a member-based organisation. We have a broad spectrum of members. We have patient and consumer organisations. We have state-based peak consumer organisations. We have research institutes and professional associations as affiliate members. So we do like to say that we represent Australian healthcare consumers and also those with an interest in healthcare consumer affairs. We're delighted that we've recently come to a reciprocal membership arrangement with ARACI as well. So all up, we've got about 200 members. We are an advocacy organisation. We advocate for impact. We partner for purpose, and we also work to build the capacity of consumer leaders and consumer representatives to play a role in shaping health policy and health service development. But I suppose if we had one mantra, it would be to say that the biggest thing we are interested in is patient and family-centred policy and healthcare delivery. This slide is showing you key shifts that we think are needed and that need to happen in the health and broader social policy or human services space. They come from a white paper we released last November that's available on our website that we released to celebrate CHF being around for over 30 years. I won't go through those in detail, but I think what they do is give you a sense of the spectrum of interests that Consumers Health Forum has. We're not only interested in making healthcare better and more people-centred and family-centred and person responsive, but we're also interested in the way the system works, how it can be better integrated. We're also interested in promoting wellness and well-being, as well as earlier intervention and better primary and acute care services. One of the big things too, I should mention that before I start talking about primary health care, that's one of our election asks and areas where we think this country is long overdue for reform, and I'll talk about why we think that in a moment. But we were just talking here in the room before we started about already, 5 days into the election campaign, we've been asked to comment a lot on the issue of costs of healthcare to families and costs of healthcare to individuals. That's a big issue, and it's something that we're going to be pushing really hard with both parties. We know that 1 in 25 people don't go to a GP because of costs. We know that 1 in 14 don't fill scripts because of cost. We know that people don't take up specialist referrals because of costs. We know that over 2 million people delay or don't go to the dentist because of costs. And what is that? That's telling us that individuals and families, particularly with your constituencies, families with children, often high users or potential users of the healthcare system, are not only missing out on specialised or personalised care, but they're missing out on, the most fundamental frontline care that we all need and should have access to, primary health care. And I think it's also telling, just on that cost to families of healthcare issue, that a recent survey by Choice reported that healthcare costs were a bigger issue in people's minds and families' minds to energy prices. So I think that tells you something about how important and why healthcare is important to the electorate in any election campaign. So integrated primary healthcare, we will be releasing our election priorities document today. That'll be available on our website, and that'll be linked to when Aracy puts the links to this presentation out. It's quite a manifesto. We've put a lot of deep thought into it. We ran a lot of member consultation forums to put it together. So I just wanted to share with you now some of the headlines or headline asks from that platform, and particularly those that I felt were of most interest or had most alignment with some of the things that Aracy is also asking for as well. But the need for primary healthcare reform, for modernising Medicare so that we've got a Medicare universal healthcare system that's much better geared to the 21st century and the sort of service we should expect in healthcare, is one of the key things we're asking for. The sort of principles that we think need to drive that reform are shown there on that slide. We're managing so much more complexity these days. Families are high users of primary health care, older people are. It all comes with much, much more comorbidity or co-occurring problems. So the need for comprehensive team-based collaborative care in a healthcare hub, if you like, that's staffed by GPs and non-dispensing pharmacists and practice nurses, nested in a medical neighbourhood where specialists are working alongside GPs as well to optimise and really personalise care is the sort of thing we're looking for. One of the things that we saw the Liberal Party, the current government, announce in the budget, which takes us a little bit along that path, is a new coordinated care, patient-centred healthcare home type model focused on the over 70s, where people over 70 will be able to enrol with the general practice, and general practice will be funded in a different way, a more flexible way, a non-fee-for-service way, so that they're not driven by activity-based funding, they're driven by and have the opportunity to sort of work with more grant-style funding, if you like, to put into place more flexible ways of delivering services to those older people. And that will include things like consultations by Skype, consultations by email, so that it's much more person-centric. It actually realises that people's time is an asset as well, and people want convenient care. And for a lot of older people with multimorbidity and morbidity and mobility problems, that's a good thing. One of the things we've advocated for strongly is that sort of model of care where families with children under 5, they should be able to enrol with a practice in the same way that the over 70s should, and receive similarly tailored, personalised, family-friendly services from their general practice in a way that the current financing and Medicare rules put a constraint on. And I think that where the sort of business case, I suppose, for that model of care really comes into play is when you look at some of the data. So, for example, in 2016-17, patients aged under 4 years and under accounted for more than 11% of all emergency department presentations. Now, why is that? If there are avoidable emergency department presentations, why are they avoidable? Well, they're avoidable probably because if we had general practice funded in a different way so that there were greater incentives for them to provide family-centred, responsive after-hours care, again, consults by Skype, being able to take a phone call in the after hours and be paid to do that, which they currently aren't, then we think that sort of service reform shift would be a good thing for families and children. This is a quote that I really like. We had a National Press Club health debate back in March, and we had Professor Stephen Duckett from one of our most respected think tanks speaking as part of our panel. And, one of the messages, one of his call-outs was that, he wants the government and decision makers within government to talk about health, not health care. And I think that's a big issue, and you'll see when our election platform is published that we have, we give quite a priority to the social determinants of health in some of our asks. And I really like this quote here from Rob Trimble, who is CEO of a very, very progressive comprehensive primary health care, social care, integrated social care enterprise in South London called Bromley by Bow. And he talks about the surprise isn't that 70% of health is driven by social factors. The surprise is that the response is to commission or for governments to fund solutions that are 100% clinical. I think that's really impactful. So the sorts of things you'll see us talking about and supporting in our election platform in the social determinants of health space is accessible evidence-based parenting programs and outreach programs like Right at Home, the one that targets mothers and babies. And I know that that's there in the RACI election platform. We're not in the business of reinventing wheels at CHF. If we think something is evidence-based and good, as that program is and really stacks up, we lend our support. So we've been very clear and explicit in saying that we support RACI's ask on that, and we'd like to see that too. Not because it's good in its own right, but it's also gold if you think about how that might integrate with a patient-centred family healthcare home model along the lines I was describing earlier as a referral pathway to better support GPs, support families. That would be an excellent reform in our view. So our election priorities in our document that we're releasing today, we've clustered them. We have a number of key asks or a number of key commitments that we're calling for. We've clustered them into these 8 themes or domains. Some of them I've talked about. Some that are probably least relevant to you, but a big issue for us is patient leadership. You see a lot of investment in healthcare in clinical leaders. Clinical leaders have access to all sorts of supports. Primary health networks are supporting GPs, get leadership skills and organisational development skills. There's not a similar investment in equipping consumers or patient leaders to sit confidently at the policy table or sit confidently at the table with primary health networks, local health networks, to really put forward a well-argued, backed by confidence view on where reform should happen. So we're asking for a number of things in that space, such as sounds very grand, but I think, in these sorts of environments, you have to be a bit bold in the sort of things you ask for. So one of the things we're suggesting is that a patient leadership academy should be funded. There's examples of those in other countries, the European Patients Forum, the UK, Plaintree in the US, where we're actually investing in patient advocates or consumer advocates to develop their leadership and advocacy skills in order to advocate with impact. Preventative health, I'll get on to in a moment. Social determinants of health I've talked about. So I'll work through some other slides now on some of our particular areas. We have, one of our key themes is investment in early childhood, youth and family. You might ask, why would a healthcare consumer organisation be advocating for that? What we're advocating for is better health, making health better. That's the title we've given our document, and we really believe that we've got to invest more in early childhood healthcare, in family health and wellbeing, if we are to disrupt trajectories into problems that are really going to be chronic and difficult to manage, like chronic disease, comorbidity, mental health, goes without saying, later in life. They are things that are going to impact on health consumers' out-of-pocket costs, on health consumers' capacity to work, on their disease trajectory, and from a system perspective on the sustainability of our health system. So that's why that's a big focus for us. And within that, we think it's really important that there's a national strategy, a national obesity prevention strategy, but with a spotlight on arresting and tackling childhood obesity. I think the figure is around 63% of children are now overweight or obese, and that's a big public health problem that we're facing. Okay, so I think you can see there in the what we want slide, what we want with regard to children. That's just a summary of the things we've talked about just now, other than to say that we've also supported a RACE's call for funding for the Parenting Today in Australia survey. Some data and insights there we think would be useful. Child and youth, the health of young people, the missing middle, if you like, is a big interest for us. You can see there a slide of a group of young people that we've formed from around the country called our Youth Health Forum. They are now networked from around the country, as I said, and they are, I suppose, our attempt to get a more organised youth voice into helping us shape our advocacy. So they've actually helped us with our election priorities. They've written a submission in their own right, and we've supported them to do that to the Productivity Commission review into mental health, for example. So we're really supporting them to have a voice as a cross-section of young people so that we can get some youth health insights into some of the policy issues that we're engaging with at CHF round the table. But some of the things that they felt were important and that we've reflected in our platform are the idea of a Minister for Youth, significant investment in mental health services and those sorts of things. So I guess in summary, I've just sort of given you a very broad brushstroke flavour, I suppose, of the sorts of things our election priority asks cover. And because we do represent Australian healthcare consumers and our membership is broad, you can understand, I guess, why we talk about everything from medicines policy and the effectiveness of Medicare, wellness and prevention, mental health, aged care, hospitals and how, what the consumer experience of hospital care is, why general practice needs to change in order to keep up with modern expectations of healthcare. It is really broad spectrum, and it's often a challenge for us to really drill down and settle on, what are some key priorities. So our election platform is very much a bit of a blueprint or a vision, I suppose, and one of the things we are asking for is a long-term plan for health, please. Something that gives people certainty about where we're taking healthcare in this country, and that's responding to one of the key takeout messages to us from a consumer sentiment survey that we did towards the end of last year, where people said the top three things that they were concerned about were cost, which I've already talked about, certainty. Australians generally feel like we have a good healthcare system, but what they're concerned about is not being able to get access to the services they need at the time that they need them. They want that certainty. They also want the certainty because they are pretty conscious of the fact that we do have to ration, we do have to make hard decisions around what is low value and high value in healthcare delivery. So I think people have got a pretty good consciousness of that. But they want certainty that our political decision makers do have a plan, a long-term plan for health, which is why we're advocating for that. And then the other big area that came through in our consumer sentiment survey, and I'm sure children, or families with children that have complex healthcare needs will experience this all the time. It's often not so much that the services aren't there, it's having the health literacy and the system knowledge and the knowledge of what's there, how to navigate it, how to access it, and how to ensure that you've got the right mix of coordinated services and coordinated care around you. We think there's enormous scope there for emergent workforces like service coordinators to play a role. We talk a little bit about that in our platform as well. So just to summarise then with this last slide, our really top three priorities where we're saying to both parties, if you do anything in your first 100 days, we really want to see some early action, some early commitments to primary health care reform, to oral and dental health care reform, some form of Medicare coverage for dental health care. That's a huge gap in our healthcare coverage, and we want to see some action on obesity prevention with a focus on childhood obesity, just to sort of arrest some of the pressures that are going to be coming onto the system and onto the costs and sustainability of the system in the first instance, but to also do something about what we know are going to be not good health outcomes and not good healthcare service experiences if children who are overweight and obese go on to develop, and they will, chronic conditions, mental health problems, and the whole gamut of things that go with that. So I might just leave it there. Hope that was useful and comprehensive, and happy to take comments or questions.
Thank you, Leanne. That was very useful and comprehensive. I'd say well done on a really well thought out policy piece that has a long-term vision and seems to be very preventative in nature, and is strongly recognised as a social determinants of health, and that there's a lot of work to do there. We've got a question in from Fiona, and she's asking, can you say a bit more about the Youth Health Forum? How do young people connect to it? Is it ongoing?
Okay, the Youth Health Forum at the moment is, I suppose its genesis. To explain its genesis, one of the things we were really conscious about at CHF was if we're purporting to represent and speak on behalf of Australian healthcare consumers, that needs to be broad spectrum. And we felt we needed a more organised way to get youth voices and the voices of young people on our radar. We also felt a commitment and an obligation and an opportunity to work with emerging young health consumer advocates to expose them to some leadership and development opportunities, and to expose them to governance opportunities as well. So that was our starting point. That was our aspiration for the forum. So we went out broadly across social media and through networks and member organisations and asked for expressions of interest from young people to join that youth forum. I think we got about 150 applications, which was great. We chose 50 against a whole, against a number of criteria you would expect, like interests, locality, those sorts of things. Brought them together into a forum last September in Canberra, a face-to-face forum, where they really got to storm and norm a bit, I suppose, as a youth health forum, and to work on an initial sort of statement, I suppose, or communique about the sorts of things that they felt were important. That communique is up on our website. The way we've been keeping them connected is really through Facebook chats and those sorts of things, and email listservs. We've now started to work with them on, how we can grow and develop it, I suppose. So it is ongoing to the extent that we've got an initial group of 50 people involved. Our challenge, like most NGOs, are capacity and resources to support something like this. So we've had some very positive discussions with both sides of politics. With the delegation of young people, we brought a delegation of 4 or 5 of them into Canberra earlier this year to talk with Minister Hunt and Catherine King and some others from both sides of politics about the Youth Health Forum, what we think it could achieve, the value it would bring to government. It also contributed to our submission and our response to the draft child and health. It's a draft. What is it? Children's and Health Strategy.
Yes.
The draft Children and Youth Health Action Plan.
Correct.
So they were certainly consulted to inform CHF's response to that. So I think in the draft of the Child and Youth Health Action Plan, the capacity or the value of a youth health forum along the lines of the ones we've got the genesis of has been recognised as a future consultative platform. So it's in place. It's got 50 young people engaged at the moment. Is it ongoing? Yes, to the extent that we can continue to support it from within our existing resources, but we're certainly hopeful that we can get some additional resources to support it, to stay networked and to play a more active role. And we're getting lots of approaches to nominate young people from that group to committees already. So we've had approaches from Headspace and Origin to nominate young people to various committees of theirs. We had a recent approach this week from the NH&MRC Community and Consumer Advisory Group to nominate a young person to that. We've also been working very early days, but very positively with the Centre for Research Excellence in Adolescent Health to, cross-fertilise, I suppose, and come up with some joint work program where we've got common purpose with that CRE. And they're looking to have some, 1 or 2 nominees from that youth forum into, I think they're calling it a council or some sort of advisory structure as part of their governance arrangement as well. So I think those approaches and the way that the Youth Health Forum has been embraced, even in that short time between September and now, sort of illustrates that it's meeting a need and filling a gap. So our hope is that we can continue to grow it and strengthen it.
Thank you, Leanne. I think the fact that you're being approached also is a vote of confidence in the process you went through to establish the forum. Clearly, it's already winning respect in its own right. And we've got another question. Could you please talk a little about your platforms around mental health and what your priority asks are in this space?
Mental health. Okay. That's very top of mind because we're just finalising our submission to the Productivity Commission review into mental health. I suppose the issue in the mental health space that has that occupies most of our thinking and time and policy work is physical and mental health comorbidity. There's many lead advocates in mental health generally that take a well-respected lead on where reform needs to happen in that area. So I guess the sorts of things we're asking for and the things that we think are important in mental health is that we need world-class specialised mental health services, but when you think about where most of the burden and cost of mental health or mental ill health is in the community, it's high prevalence disorders, depression, anxiety, the ones that are quite commonly comorbid with diseases like diabetes, people with pain, people with in need of joint replacements, all of those sorts of things. So I think the key thing for us is we want a care delivery system that has mental health care well integrated into it. So programs like the Better Access program, where GPs are incentivised to develop mental health care plans and integrate them into chronic condition care plans, and then coordinate a set of referrals to a team that includes psychologists, and could include psychiatrists as well as other allied health providers, is the sort of model. But we're also very conscious of the deficits in that model that people like Ian Hickey and Sebastian Rosenberg write about so eloquently, is that model and that Medicare finance model and equitable access to that is so driven by where the workforce is. So if you don't have to go too far out of capital cities to not have psychologists available in your town. So you might well have a Medicare incentive there. You might be able to access up to 10 subsidised visits to a psychologist, but if the workforce is not there, then we've got a problem. So the other big area of promise we see is the role and function of the primary health network, that decentralised network we have in the country now, who are increasingly being tasked by government to commission locally mental health services. And we think that's an enormous opportunity because it involves or provides the opportunity for local clinicians and local consumers to be involved in working with primary health networks to determine what mix of services they commission and how they're configured. And back to the social determinants stuff too, one of the big aspirations we have for primary health networks, and we're starting to see shifts along this line in other countries, and it's a slow burn, but you can contemplate a scenario where they could also be co-commissioning or commissioning services that are non-clinical in nature, but that provide those really important social supports that, as part of a mental health care plan for a young person or someone with lots of multiple chronic conditions and comorbid depression, that incorporates some of those really important social supports that are going to play probably as important a role, if not a more important role, in that person's capacity to manage their mental health issues and live a contributing life.
Thank you, Leanne. I think going back earlier in your talk, you talked about making solutions, moving them from the national to the local, and something that's been going through my mind is Aboriginal controlled health services, which seem to, from everything I've read and understand, they're very effective and they're a great example of local models. The other thing that really jumped out at me was making the health system much more person-centred, and I'm just wondering if you could talk to, part of that problem is, I guess, cultural generally. If you're a dentist, you sort of focus on teeth, or if you're an eye doctor, you focus on eyes. Is this a training issue? Is it a cultural issue? How do we get when someone comes in brings their child in to see a dentist, and there's a problem with their teeth that clearly, it needs a clinical fix now, but it's clearly driven by poor diet or socioeconomic factors. How do we get that dentist thinking beyond the mouth? And
that's a good question. Look, I think it's cultural. I think it's a product of the way clinicians are trained, in part, for sure. I think it's a product of how services are funded as well. So, if you think about the way clinicians are trained, one of the things that we think can help overcome some of that, body part focus, if you like, or lack of a whole of person focus, if you like, is they will always need, obviously their specialist training, but some greater attention to, raising awareness and giving clinicians the skills and the knowledge to take a more person-centred approach. So one of the National Health Service quality standards is a standard called patients as partners in care. So what does that translate into in terms of the practice that we want hospitals and other service providers to demonstrate? So it's introducing skills to them, like how do you support patients to better self-manage when they're not sitting in the consultation room, for example. What sort of, because I think then the other thing in terms of training and education and where we want workforce development and innovation to go from a person-centred care perspective is person-centred care. One of the epitomes of it is team-based care, to have a team of people around you, for the very reason that the dentist will look after the teeth, or a nutritionist might help a family with children with overweight issues. Someone's got, if a family's got a child with type 1 diabetes, for example, in denial, huge issue, you're bringing in, and you should be bringing in a social worker and some psychology to support, the sort of acceptance of that disease and support that child to better self-manage that disease in the family context. That's all about team-based care and team-based practice. So some of that, changing the way services are funded so that they can be delivered and procured in flexible ways, is part of the solution. But also, educating, and a lot of curriculum is going this way anyway, educating providers and clinicians in a more interprofessional way, so interprofessional education and skilling them in interprofessional collaborative practice as well. So it's cultural, it's education, it's funding models, and it's workforce working to their full scope of practice, being aware of what their respective skill sets are, and really embracing that team-based model.
Yeah, seeing the social worker as part of the team, and vice versa, and speaking a more common language, and looking at the, in our case, Aracy, looking at the kid as a whole.
Yeah, and the family context in which that child sits.
Exactly, working with the whole unit.
Yeah.
Great. All right. I think we've just about done our time, Leanne. Thank you for that presentation, and
that was useful.
We're very excited to see your policy piece going out. We'll look for it on our internet web pages
quite
today.
A few common asks in there.
Indeed, yes, and we were very pleased to see the youth minister. We think at Aracy that we should have a youth minister, and probably that person ought to be the Prime Minister, because if someone's going to lead the nation, the future of the nation is our children, and at the end of the day, you need a big stick to get cabinet to do these sorts of integrated things. Again, and I wasn't just picking on dentists earlier. Ministers have their portfolios, and it's sometimes hard to get them. Quite naturally, sometimes hard to get them to think beyond their patch. So, and we need a more integrated approach, as you've so beautifully laid out today.
Intergovernmental agenda is important
Indeed.
In this space, for sure.
And the Federation brings its own particular challenges with that as well, of course.
Additional overlay, that's right.
Leanne, thank you so much, and thank you to those who attended and those who sent their questions through. A recording of this presentation will be available fairly soon, probably at the end of this week or early next week on the Eracy website. We ask you to revisit it, listen to it. Please share it with your colleagues when you find it. We'll be putting it on our Twitter account. I'm sure CHF will as well. We've got 2 more webinars in this election series. Next week we'll be hearing from the Smith family and the things that they want to see the next Australian government do for the well-being of young Australians. And after that, we'll have Professor Anne Sanson, who will be talking about what the impact of climate change on the health and well-being of young people and what the next Australian government should be doing about that with some urgency. So again, my thank you to Leanne.
Thanks.
My thank you to everyone who attended and for your questions. Please keep an eye out for this recording, and we'll see you next week when we hear from the Smith family. Thank you.